Hi, everyone. Um, Sorry I couldn't be here today. I made this in case I wasn't able to participate in presenting with my group. We had a lot of fun working on this project together. We chose to do self care and midwifery through the group practice model and how those are interconnected and what that would look like and how that would work. So, I'm going to go over the benefits. But before I go over the benefits, I kind of wanted to talk about what burnout is and what we found regarding burnout. It was kind of I like this little quote that I have here from Sindhu et al. About burnout is defined as chronic occupational stress resulting in a loss of energy, disassociation from work, depersonalization, and emotional exhaustion. I'd also like to add that it could also include physical exhaustion as well as the emotional exhaustion. And the loss of energy can be from a lot of different factors that we will discuss. Burnout, also, I found this study very interesting. It was done on Canadian midwives and asking, they did a study that asked all the Canadian midwives what the causes of their burnout were. Some of these listed here, like planning to leave the profession. I found that one interesting because they didn't really follow up and discuss if they were planning to leave the profession and then got burnout, or they were already burned out and they decided to leave the profession, and that's when they were um, asked that question in the study. Having young children, this can obviously be complicated in trying to have a good support system and people to support you. And when you don't have that, that can make going to work and being on call a lot more challenging without that support system. Not having days off was a cause of burnout, which is one that we will discuss more heavily in this group practice model. Having symptoms of anxiety and depression and stress, and also just having more negative and challenging practice environments. This one, I wish they would have gone into a little more depth about like what exactly they experienced as the challenging environment or negative environment. It didn't give much detail on exactly what that was. And then also not feeling valued by team members. This is another one that's going to be really important in the group practice model. So, just a brief look at some of the benefits of having the group practice model is being able to have time off call, more time for yourself, time for families and friends. Also, like in the workplace, it's nice to be able to, if you have a double birth, that you're able to kind of do the divide and conquer method. And also, as well as having a group practice model, you're able to do a lot more peer reviews and it makes the learning from each other process even more strong. This group practice model is designed to reduce the risk of burnout, um, but it's not just resolved by adding more time off. Having more time off is only the first step. It also, you need to actually spend that time off doing self care things, not just simply having the time off. As well as in the group practice model, there needs to be teamwork and communication, and the team needs to collaborate together in order for it to be successful. And there are also some limits that will be discussed as well in this group practice model. But most importantly, if it doesn't work for our clients, then it's not going to be a good model. So we looked into a couple different studies that showed that the clients actually didn't have a more negative experience when they were receiving care with the group practice model, and that they were able to continue, like the continuity of care was still present. And um, Perella also showed that the private midwife did rank higher in satisfaction than a group model, but it wasn't by very much. But what was key about that, of why the private midwife was better, was specifically that postpartum care was often rushed. And so that's something to note, that if you are doing a group practice model, to really focus on the postpartum care and the communication between the group, all the members of the group. And then also really focusing on building an individual relationship with the client through the group practice model. And I will let the next person present. Thanks.